Hello, everyone. My name is Joe Kelly. I am the Community Relations Program host at the Rochester Hills Public Library, and I'd like to welcome you to this evening's program, a virtual health talk, Understanding Healthy Sleep, with Ascension Providence Rochester Hospital, featuring Dr. Bradford Woelke and Stephanie Bauer from the hospital's Community Health and Education Department will be introducing him. Tonight, attendees will remain muted throughout the program. Please use the chat feature below if you have any questions. At the end of the program, we will be taking a few questions and going over all of those. The program will be recorded and it will be available to view on the library's YouTube channel about 1 week from tonight. And for now, I will turn things over to Stephanie, who will introduce Dr. Woelke. Stephanie, please take it away.
All right. Hello, and thank you for joining us this evening. My name is Stephanie Bauer. I am a nurse coordinator in the Community Health and Education Department at Ascension Providence Rochester Hospital. And thank you so much for the Rochester Hills Public Library. Their team has been amazing and just a pleasure to work with this year. And we look forward to working together next year in 2021. This is our last program this season, so it's been a good one. Tonight's virtual health talk on understanding healthy sleep, again, is brought to you by Dr. Bradford Woelke. He is a family medicine physician, and he's completed his undergraduate studies at Kalamazoo College, earning a Bachelor's of Science in General Biology. His medical school was completed in 2018 at Wayne State School of Medicine, and he currently is a resident physician with Wayne State University School of Medicine's Family Medicine Residency Program, where he sees patients at the Rochester Academic Family Medicine Outpatient Center, as well as at Ascension Providence Rochester Hospital. He recently was appointed to the Michigan Academy of Family Physician Board of Trustees, and he has academic interests in athletic sports medicine, sleep medicine, and nutrition. And outside of work, he enjoys spending time with his wife, Sarah, backpacking, and kayaking. Please welcome Dr. Woelke.
Muted myself there. Thanks for having me. All right. I'm going to go ahead and share my screen. Give me a moment. Can you let me know if this is full screen or not?
Yep. Oh, not in full screen.
All right, let's see.
Try the present view.
That work? No. Okay.
You try looking at it under view.
Hold on a second. There. Did that work? Oh man, it keeps minimizing it.
All right.
Let's try this one more time. Open this one up. And we had this working a second ago. Oh, I think that's it. There, that should work.
Yep. All right, there we go.
Okay, yeah, so thanks for having me. This talk today is just going to be, a community focus on understanding healthy sleep. And like everybody just mentioned, my name is Bradford Woelke. I am a family medicine resident. I work over at Ascension Rochester Hospital at the Rochester Academic Family Medicine Center, third-year resident. And so this talk is geared towards the layperson to kind of help you understand some of the common misconceptions about sleep. So here's a little overview of what we're going to talk about today. We're going to start off by defining sleep, discussing what it does and how much we need, what happens when you don't get enough sleep, what is sleep hygiene and some sleep disorders, and just a kind of couple highlights on some of the medical stuff at the end. So what is sleep? According to Wikipedia, the sleep is a naturally recurring state of mind and body characterized by altered consciousness, relatively inhibited sensory activity, reduced muscle activity, and inhibition of nearly all voluntary muscles during rapid eye movement, and reduced interactions with surroundings. So if someone came, I like this, this little analogy. If someone came from another planet and they saw, people going about their daily lives and they saw someone going to sleep, they might think they were dead. You're basically in a lot of times in a state of paralysis. You're just really not reacting with your environment at all. But that's kind of a, esoteric definition. What sleep really is it's where we do our memory consolidation, neuronal housekeeping, and it sort of just re-optimizes us at the end of the day. There's 4 stages to sleep. Just go over this. It doesn't really have a ton of practical impact, but there's the non-REM stage 1, stage 2, stage 3, and REM sleep. REM sleep is where you do your dreaming, and non-REM sleep is kind of where your body just kind of goes into like a relaxing stage and does some of its restorative functions. So you can see non-REM here is the dreamless sleep. This chart right here kind of shows, I don't know if you can see my mouse or not, but it kind of shows the different levels of sleep. And you can see you spend a lot of time here in this deep non-REM portion, and we just kind of barely peak back up into the REM sleep. During the non-REM, like I said, we get a lot of memory consolidation and some of the housekeeping. And actually, it's important to notice here too that proportionally, REM sleep becomes more and more abundant towards the end of sleep. So if you're cutting off how much sleep you're getting, you're really actually limiting how much REM you're getting, because you can see in the last couple hours, proportionally, there's more REM sleep than non-REM sleep towards the tail end of your sleep cycle. This is a crazy dream picture I liked. But this is, like I said, where the REM sleeps where you get your vivid dreaming. It helps consolidate procedural memories like cooking, tying shoes, playing a sport, board games, things like anything like that, which is kind of repetitive, gets consolidated during this portion of sleep. And then, there's all sorts of crazy theories like Freudian theories and stuff, and Jung about sleep. Alcohol, interestingly, inhibits some of this sleep, especially when used chronically. So what actually makes a person fall asleep? There's actually 2 processes which largely drive the control of sleep, process C and process S. Process C is the circadian clock, or kind of the circadian rhythm, if you've ever heard of that before. And process S is really your sleep drive, which is caused by a buildup of some different metabolites, and we'll talk about that in a little bit. Light plays an important role on the process C. It comes in through the eye and affects the suprachiasmatic nucleus, which kind of sends some signals to different parts of the body, which influence our wakefulness, among other functions as well. Let's see here. All right. Oh, we can see it. Great. Let me put this over here. So more about the process C. You can see here it's on roughly a 24-hour cycle. It's really close to like 25 hours. But it's regulated by the sunlight. When you're exposed to sun, which is pretty much all the time, it's a 24-hour cycle. And it also regulates things like cortisol and melatonin, temperature, when you're hungry, and when you're awake. What is melatonin? People hear about that a lot, and a lot of people use that for sleep, as a sleep aid. But why does it actually work? Well, what we see here is that as the day goes on, closer towards when we're getting ready for bed at about 8 o'clock, we start getting a peak in production of melatonin, and it kind of spikes around midnight and drops as we're getting ready to wake up in the morning. It's produced in the pineal gland, which is a portion of the brain controlled by that suprachiasmatic nucleus, which gets the light inputs, and it sort of tells the body when to fall asleep. Influenced by genetics and habits, this can actually shift. If you're a night worker, your melatonin production might actually be a little bit different than someone who works during the day on a regular 24-hour cycle. And some people are predisposed to wake up a little earlier than others. Some people go to bed earlier, get up earlier. Some people go to bed later and wake up later. It's all kind of determined by your genetics as well. So one thing that kind of makes this practically important is that the circadian rhythm, for the most part, stays steady, and it usually changes slowly with the seasons. And if you think about when the sun rises and the sun goes down, it changes pretty slowly as the year goes on. But one time that this actually can make a big difference is something like when you have jet lag. And so, here we see maybe your normal getting ready for bedtime is around maybe 10 o'clock, 11 o'clock. Yeah. In Michigan, it's 11 when you're getting ready to go to bed. You get this big spike in melatonin. But then you decide to take a flight and you go to California. Well, what actually happens here is that your bedtime, your body still thinks it's 11 o'clock. But when you reach California, you're 3 hours off. And so you start getting sleepy around 8 p.m. and you kind of want to fall asleep then, even though everyone else around you is still up who lives in the state. And it takes about 1 day to adjust for 1 hour of sleep lag. So for, every time you change your time zone, if you go to Hawaii, I think that's 5 or 6 hours off. That's going to take you almost a week to fully adjust to that time zone. And I just want to say too, if you guys have any questions, I do have the little chat bar up on the side. So if you want to ask anything, feel free to shoot a question in there and I can try to address it. So how do you actually use this in a meaningful way for sleep? One thing you can do is actually, you can take melatonin about an hour before you want to go to bed, and it can actually help tell your body to fall asleep. So for some people that maybe have a hard time starting to fall asleep, this is a good choice. 1 hour prior to when you want to go to bed, you can take 3 milligrams, maybe up to 6 or 10 at the most. You can talk with your doctor about how much you exactly should take, but it's a pretty safe over-the-counter medication that you can buy and try on your own as a sleep aid. Like I mentioned here, it's best used for disrupted sleep. So maybe like if you're going on, like I said, changing a time zone, or if you're delayed sleep phase, this could be something you could try. We talked a little bit about process S. I'm going to go back to this earlier slide here. Process C, we see here, kind of goes in a normal pattern, and process S goes up and peaks at about 11 whenever you fall asleep. And you can see it drops while the person's sleeping. So what exactly is that? Oops, wrong way here. So what it is an accumulation of metabolic byproducts. One in particular we look at is called adenosine. And as the brain kind of goes about, doing your activities, creating memories, reacting to your environment, it produces this molecule called adenosine, and it peaks, increases as the day goes on. And when you sleep, your body kind of flushes it from the brain. You can see that here. This is kind of a complicated chart, but it's pretty much the same thing I showed earlier. The process C, or the circadian rhythm, and the peak and the drop, the process S. Now, why do I show this coffee? The reason I show coffee is because it's probably the most commonly used, stimulant in the entire country, maybe the entire world, I don't know. But it's, you talk to most people, they'll tell you they probably have at least 1 cup of coffee in the morning. But how does it work exactly? So again, we got this chart here, and when we get more and more adenosine, it makes us more and more sleepy. So the higher levels help tell our body, okay, we're exhausted and go to sleep. But when you drink the caffeine, what it actually does here is the caffeine blocks the receptor that the adenosine normally binds to. So even though the adenosine is still going up, you don't feel it. You don't feel that drive to go to sleep. You're more awake. And what ends up happening here is that if you use enough coffee and you don't sleep, you'll just keep building up this adenosine here. And you can see that on this red line. And you won't necessarily feel that until the coffee wears off. And we'll talk about a little bit about when that happens. But the adenosine keeps building up in the brain until you sleep, so you'll get this overwhelming urge once the coffee wears off to go back to sleep. So it doesn't really help you in that sense. So the reason we say don't consume within 6 hours of bedtime is because that's about 6 to 8 hours is how long it takes your body to metabolize caffeine. And it's also dependent on how much you drink as well. So we talk about, with caffeine, limiting your total consumption. Now, this is a normal cup of coffee, 95 milligrams of caffeine. Red Bull, about the same. You can see how much decaf or tea is. So you just want to keep that in mind when you are drinking caffeinated beverages. Even a can of soda pop is about half as much as a cup of coffee. So this is a pretty significant contributor to caffeine as well. And then tolerance builds too. So if you drink a lot, you will require more and more to actually get the same effect. I like this a lot. Oh, can I go? Yeah, sure, we can talk. Oh, okay. Did you still have a question about the adenosine? I just saw in the messages. No, okay. So yeah, but just to summarize, the adenosine peaks and the caffeine sort of blocks your brain from recognizing it, and so you're really just tricking yourself into not thinking you're tired. And it can be useful, if you, in certain situations, but depending on it chronically, it's not really a good strategy because you're not really addressing the underlying issue. Here's some of the negative things associated with sleep deprivation. I got this from John Hopkins, Effects of Sleep Deprivation. I really like this infographic. If you look here, 6,000 fatal car crashes caused by drowsy driving. 1 in 25 adults have fallen asleep at the wheel, which you can imagine is not going to be great for health outcomes. But I thought some of these other ones on the bottom and the right here were interesting too. You have a 33% increased risk in dementia. It's apparently aging on your brain. It actually increases your risk of developing heart disease. So people that were chronically sleep deprived are more likely to have a heart attack than people that weren't. You're 3 times more likely to catch the common cold. Maybe you could even relate that to other viruses as well, especially in light of the pandemic right now. Sleep's probably more important than ever for protecting your immune system. Increased risk of high blood pressure, colon cancer, risk of obesity, and the less sleep you get, the more cravings for kind of some of our bad foods that cause weight gain as well. So there's a lot of good reasons for why we want to get sleep and not to run low on it. I thought this was an interesting study that I like to kind of show people. It was a one-player study. This guy's name is Andre Iguodala. A couple years ago, he was on one of the championship teams for Golden State. He's a pretty famous NBA basketball player. And he was sleeping less than 8 hours a night. And what they did was they took a before and after, and they said, okay, you got to sleep 8 hours every night, exactly. And what they saw was he had an increase in his points per minute, which is important because in basketball you win by scoring more points. He reduced his turnovers. He was more accurate on his shooting, 9% increased free throw percentage. He was able to play more and shoot more 3-pointers. But, so this is really important for people that are involved in athletics and things of competitive nature like that. But what about for people that aren't, pro athletes? What's some benefit for getting enough sleep besides the health outcomes that I mentioned before? So this was a nice little study that showed trouble sleeping associated with lower work performance and greater healthcare costs. This was from a data set of Kansas employees in a wellness program. And so what they took here was, it was a pretty big study. They took almost 12,000 people and followed up with 5,000 of them. And they looked and found that people who had higher levels of sleep were who had higher levels of sleep disturbance were more likely to miss work, have lower work performance, and have higher healthcare costs. So, essentially, if you're not getting enough sleep, you're probably not going to perform well enough at work. If you want to keep your job, you want to perform well. If you want to, make money and be at the top of your game, sleep is an important part of that. Oops. So a common question is, how much sleep do you actually need? And the answer to that is it depends. So the amount of sleep you get per day varies as you age. When you're a baby, you sleep a lot, 14 to 17 hours. Now, it's not all continuous sleep, but it is a really large amount. And then you see that kind of decreases as we get older, from 14 to 17 to 8 to 10 as a teenager, and then, at least 7 as an adult. And, a lot of people aren't able to get that 7 hours of sleep or don't think they're able to, but it's really important. A couple things I want to talk about, because some of the people in this talk might have kids at home or teenagers at home that are in high school, and it can be kind of frustrating because it seems like all they want to do is stay up late, and that's true. Puberty naturally makes kids want to sleep later, so they're more likely to fall asleep at like 10 or 11, and they need, like we mentioned here, 8 to 10 hours. So if they're falling asleep at 10, ideally, and they need 9 hours of sleep, they'll be waking up naturally at about 7. But if they're staying up till 12, they're not falling asleep at their ideal time, and they're more likely to be tired if you wake them up at 7 o'clock because they only got 7 hours of sleep when they really need probably closer to 9 or 10. So one thing you can do is just kind of be understanding of that, but also encourage consistent bedtimes, even if it's a little bit later, but make sure they're not staying up much later past this, because then they're going to be cutting off that restorative REM sleep at the end. And then you get some changes too as we age. Often for a lot of different reasons, we'll have more frequent awakenings, and we'll get into a little bit about that. Decreased REM sleep, because we're cutting off some of our sleep at the end. We're not getting as much, so we're getting less REM sleep. Medical conditions like pain, restless leg syndrome, menopause can all play a part. And then particularly poor sleep hygiene habits. And this is what we're going to focus a lot on, because poor sleep hygiene is something that is within everyone's control. That's the first thing when someone comes into the office and says they can't sleep. I always talk to them about what their sleep hygiene is like. And a lot of people, it can be a problem. And, we'll get into that in a little bit. A couple of key terms just to keep in mind as well. Sleep debt. So when you don't get enough sleep, you get cumulative effects. Some studies have shown actually that if you don't get enough sleep on a chronic basis, you actually get acclimated to that lack of sleep, but you don't necessarily get acclimated as far as performance goes, like that Andre Iguodala study. So while you might not feel as tired after a couple of days of missing enough sleep, you're going to perform poorly, but you just won't perceive it as well. So for people that are really getting a low amount of sleep, you're cutting yourself short. You might not even realize how much better you could be doing if you were getting more sleep. Power naps. What are power naps? You'll probably hear about that a lot in the news and the media. Power naps are usually long enough to recover or gain some benefits without inducing sleep inertia. And what that means is when we looked at that earlier figure that showed the REM sleep and the non-REM sleep, if we only took usually about a 20 to 30 minute nap, we don't actually get into that deeper phase of sleep. And that's where you start feeling kind of groggy, because your body starts going into that paralysis mode where it sort of locks yourself down and you don't do it and you don't move and stuff like that. So if you take too long of a nap, a normal sleep cycle is 90 minutes. If you only sleep 45 minutes, you'll be halfway through your sleep cycle and you'll feel really tired, the sleep inertia, when you wake up. So you want to keep your naps to 20 minutes if you can. And naps can be helpful. So this was a study that showed the role of a short post-lunch nap. When I was in Spain, they often would take what they called a siesta, or a little post-nap lunch. And there's some science to back up why that's important. It can improve cognitive, motor, and sprinting performance. And this was in some athletes. So here, this is a lot of words, but this was the abstract of the study. And what they found was that alertness, sleepiness, short-term memory, and accuracy all were improved by napping. These were athletes. Their sprint times were also improved. And in this little study, it was only a 10-person study, but it showed that post-lunch nap actually improves alertness and aspects of mental and physical performance. So again, it's just like if you're not getting enough sleep, you don't want to make that into a habit, but if you do miss it, you can try to make up for that with a short nap once a day. But it's important also that you're not taking that nap too close to bed. If you take a nap too close to bedtime, you actually kind of disrupt that adenosine cycle as well, and it can make it hard to fall asleep. Or if you're taking naps for too long, that can be disruptive as well. And that's one common reason that a lot of older patients, when they come into the clinic, will say they can't stay asleep at night. And that's because they've gotten into a bad habit where they don't sleep a lot at night. So they take long naps, maybe more like an hour, 2, 3 hours during the day. And then at nighttime, they're not able to stay asleep because they've sort of disrupted that natural cycle of sleeping. So a couple of take-home points. Excessive napping. It actually disrupts your normal sleep, like I just mentioned. Increases sleep inertia, so you feel really groggy when you wake up. Sleep debt is cumulative. And one thing I didn't mention is that while you build up a lot of sleep debt from chronic sleep deprivation, one good night of sleep doesn't usually correct it fully. It takes a couple days really to start fully getting the benefits of adequate amounts of sleep. So just, maybe a good example would be getting enough sleep on a Saturday or Sunday isn't going to be enough to make up for only getting 4 hours of sleep a day during the week. So you really need to make it a habit to get enough sleep rather than to be the rule that you're not getting enough sleep. And we talked about some of the undesirable medical conditions like dementia, heart disease, hypertension, weight gain, diabetes, which are associated with insufficient sleep. Adequate sleep is also associated with optimal workplace and athletic performance. So if you're an athlete or, pretty much everyone works, you're going to want to make sure you're getting enough sleep so you can perform at your best. So how can you actually improve your sleep? That's probably why you're here for this lecture. You want to know what types of things can you actually do to get a better night's of sleep, besides just trying to prioritize how many hours you're getting. Well, this is another really good infographic I like. helpful tips to help you sleep. So we talked about fixing a bedtime and awakening time. Essentially what you're doing here is if you pick a time to wake up in the morning and time to go to bed at night, that's roughly the same within an hour every day. You're kind of helping that process see that circadian rhythm, and your body will naturally start telling you when to get. If you normally go to bed at 11, and even on the weekends you go to bed at 11, or maybe just an hour later, you're going to be able to fall asleep better, more consistently if you do it that way. We talked about avoiding napping, or making sure you limit the naps to 20 to 30 minutes for the power naps. Avoiding caffeine 4 to 6 hours before bed, which we already kind of talked about, because that's not letting your body realize that process S. So you want to make sure that, pretty much I tell people a good rule of thumb, if you're going to have caffeine, try to keep it before noon in the morning, and don't have more than 3 cups. Don't have a pot of coffee. Don't have a cup of coffee at 5 o'clock. That's going to keep you up. You're going to have a hard time sleeping at night. Exercise can help sleep, but not within, I tell people, not within, you want to make sure you finish your exercise at least an hour before you go to bed. So, if you're going to bed at 11, you really want to have your workouts done by 8. You want to start them at 8 or 9 and be done, by 10. If you get too close, you'll be too stimulated. You won't be able to fall asleep. Comfortable bedding, blocking out distracting noise, reserving the bed for the 3 S's. They say sleep, sex, and sickness. So just basically what that means is don't watch TV in bed. Don't use your phone in bed. Just use the bed for essentially sleep. This talks a little bit about electronics. The reason we say not to use electronics about an hour before you go to bed is because they're pretty stimulating. So your mind's going to be kind of racing or thinking a lot about different types of things before you fall asleep. And then there's some blue light that comes off as well. I'm going to go back pretty far and just kind of bring this up again. If you look at this light, when it hits the eyes, affects that circadian rhythm here, that process C. And so the light that comes from the sun is specifically in the blue wavelength of light. And so if we use screens or phones that have blue light, it kind of mimics that natural sunlight, and it disrupts our body and says, hey, it's not really time to go to bed yet. It's still daytime. So you need to be careful about that. Something you can do is not using your electronics an hour before you go to bed. There's also applications like Flux that you can use. That's a program you can download on your computer. Flux, you can set when you want to go to bed, and it gradually tapers the color of your screen so it emits less blue light. That's one thing for people that say, hey, I really can't, I'm always on my computer. You can try Flux as one way to do it. And a lot of the iPhones have built-in blue light filters as well you can try to use. When you're getting ready for bed, a light snack, some warm milk, but I really say don't eat too much. If you have a large meal before bed, that also can make it hard to sleep. We're going to talk about some relaxation techniques in about a second. And then we'll talk about some medical conditions that might be beyond your control, and you might have to kind of reach out for a medical professional to help with some sleep issues. So the military has this, allegedly, I've never actually seen it myself, but they teach this technique, fall asleep in 2 minutes. But essentially, it's almost like a meditative technique. This is very similar to what you might do in a yoga class or guided meditation. You can sit on the edge of your bed with your phone silenced and your alarm ready. Put your phone away, relax your muscles, and you work basically from your head down to just kind of mentally think about relaxing your face, your arms, your chest, all your muscles, and focusing on your breathing. Clear distractions, and then lie down. And this can be a really helpful way to fall asleep. It's like I said, essentially this is what we tell people to do when they meditate. And you're really just clearing your mind and relaxing your body. And that's one thing you can try to do to help induce sleep when you're ready to actually go to bed. Talk about a couple medical conditions now. The first one we'll talk about is insomnia. This is probably the most common, or one of the most common causes of poor sleep. Reasons for chronic insomnia, poor sleep hygiene, stimulant use. Talk about caffeine or maybe even ADHD medications can be stimulating. Some SSRIs can cause insomnia. Those are medications like fluoxetine or sertraline, Prozac, things like that. Chronic pain or PTSD or Opiate dependency can all be causes of insomnia, and there's many, many more. This is not an exhaustive list. This was just to kind of give a couple examples. Some treatments we talk about improving sleep hygiene. We just went pretty extensively into that. That's always my first choice if we can avoid doing the medications. Cognitive behavioral therapy is a good choice. That can be difficult to find. You want to find someone that's actually trained in cognitive behavioral therapy. We do have some groups like Eastwood Behavioral Clinic. They're around that I send patients to. They do some cognitive behavioral therapy for sleep. And essentially all that is just training yourself not to have negative thoughts or racing thoughts in your mind before you go to sleep. So they can teach you some of those meditation techniques and other things that you might maybe have some abnormal thought processes that prevent you from going to sleep. We'll talk about some medications in a second. Some people use cannabis to help them sleep. Generally, that can be okay, but if you rely on that too much, or if you consume too much cannabinoids, that can be habit forming and really doesn't lead to as restorative sleep as if we can with these other non-medication techniques. The FDA, which is the Food and Drug Administration, has approved some medications, and the American Academy of Family Physicians, or the AAFP, has a couple of recommendations as well. The first line is a medication called doxepin. This is actually an interesting case because doxepin is an old medication of a class called tricyclics, which were actually used originally for depression. But what they found was if you use doxepin at very low doses, much below the dose that's used for depression, it's actually great at blocking the histamine receptor. And histamine is responsible for, or one of the things histamine is responsible for, is being awake. That's why some medications like Benadryl can be pretty drowsy inducing as well, because they're also histamine receptor blockers. The nice thing about doxepin, though, is that it only retargets that histamine receptor, and it's almost what we call a clean medication. And at the low doses used for sleep, we don't really get that many side effects. So that's a first line choice we can use. Another one's a medication called Melatonin, but this is essentially very similar to just using melatonin. So in practice, I haven't seen this given much because often we'll just tell patients to use melatonin, but this works at the melatonin receptor to block that and actually help induce sleep. There's a couple of what we call non-benzodiazepine drugs. Those are medications like Zolpidem or Ambien. Those can be really great medications when used sparingly. They are really good at actually inducing sleep, and they help people fall asleep. But the downside with them is they can be quite habit forming. Once you use them, they work so well that people find that they're not able to sleep at all without them anymore. So you can become kind of dependent on those, and they're pretty hard to come off of, in my experience, for patients once they've started them. Times I like to use those in particular, those medications like Ambien would be maybe like if you know you're going to be trying to go for like a big exam and you have to get a great night's sleep and you're really worried, or maybe if you're taking like a long flight, it's going to be noisy. Those are some times when I think those medications can be helpful, but I try not to use them chronically. And there's some other medications like dual orexin receptor antagonists. When you get in that far down, you're really looking more at like having to see a sleep specialist, like a sleep neurologist or something like that. There's some off-label medications. Quite commonly, we'll use medications called trazodone. Again, these ones work at the histamine receptors. So you might have seen a family member that's been on those medications, and those are safe medications. They do have some side effects, but off-label trazodone's pretty commonly used for sleep. Medications we like to avoid are things like Xanax or Ativan. Those are particularly addictive, and in older adults, they can cause, they're pretty unsafe and are associated with a lot of falls. And then Benadryl was another medication I mentioned. We try to avoid that in older patients as well. That one in particular has been associated with a lot of falls too, so we try to avoid that. If anybody has any questions about this in particular, you can ask now or you can wait till the end and we can cover them. So, all right, another one that's pretty common is obstructive sleep apnea, or OSA. So obstructive sleep apnea, we screen for this a lot at our family medicine clinic. Don't actually do the tests for confirming it, but this is what's called the Stop Bang screening score on the right-hand side. And these are the questions I ask people when usually when they either complain of not having restorative sleep or not being able to stay asleep. I'll go through this. So one of the questions is, do you snore loudly? Do you often feel tired, fatigued, or sleepy during the daytime? Has anyone observed you stop breathing during your sleep? Do you have high blood pressure? Older age, above the age of 50, is associated with sleep apnea, as is a large BMI, above 35. For people that don't know, normal BMIs are 20 to 24. That's considered an average BMI. 25 to 30 is considered overweight. Above 30 is considered obese, and above 35 is considered very obese. So these are people that are a bit on the heavier side. That's a risk factor as well. Neck circumference, a lot of times that does correlate with the BMI, but that gets its own point. And then unfortunately for us guys, male gender is also a risk factor for obstructive sleep apnea. Now, luckily, we do have a pretty great treatment for this. Usually, well, one thing you can do is modify your risk factors. So if you're able to lose weight, a lot of times the neck circumference will come down and the BMI can come down as well. And oftentimes as well, if you do lose weight, you don't have to be treated for high blood pressure. So there's a lot of great things that come with weight loss, and you can talk to your doctor about different strategies for weight loss. If you have questions about that, there's a lot of options. Sometimes it's medications, sometimes it's surgeries. Unfortunately, we can't change our gender, we can't change our age. So those are kind of unmodifiable risk factors. But if you're not able to lose the weight and you just want to know, well, what can I do other than that? CPAP is one thing, but usually what that requires is that's what's considered continuous positive airway pressure. It's a machine that helps you sleep at night. I don't have a picture of it. I should have put this in here. Probably most people have seen this before. It's like a mask you wear while you're sleeping, connected to a hose that forces air into your lungs and helps you open up your airway. And a lot of people find that their sleep is much more restorative when they use that machine. And even people that are claustrophobic, there's different types of appliances that you can use with a CPAP. Some that just go in the nose, for example, that can make it more tolerable. But in order to get one of these CPAPs, you have to see what's called a sleep medicine specialist. A lot of times those are neurologists or internal medicine doctors. And they'll do what's called a home sleep study first. And then if you qualify, they might do an in-house sleep study where you have to go stay at the hospital or you stay at a sleep study center. And then they'll determine if you qualify for the CPAP. But if you talk to your primary care physician, they use something like this stop bang score. They can determine whether or not you'd be a good candidate to potentially utilize a CPAP. This is pretty uncommon. But it gets portrayed a lot in the media, I think. Narcolepsy. Main symptoms are things like daytime sleepiness, cataplexy, which is actually emotionally triggered loss of voluntary muscle tone. I should have put a video up of this, but if you look it up on YouTube, there's some pretty interesting videos of people where they laugh and it actually induces them to it almost looks like they pass out and they quickly wake back up. They can get sleep paralysis at night, which is a sensation where you're lying in bed and you can't move your body, but you know you're awake. So sometimes sleep paralysis isn't always correlated, isn't always related to narcolepsy, but narcolepsy often has sleep paralysis. And then what we call hypnagogic hallucinations, which just means this is almost like daydreaming, where it'd be similar to you could be sitting in a chair, quickly fall asleep and immediately fall into that REM sleep where you're dreaming. And so people who often have these hypnagogic hallucinations report very vivid dreaming that comes on very suddenly and quickly. Family members might say that they could be sitting in the chair and fall asleep within seconds. This is diagnosed with sleep studies and then based on symptoms. There is some testing, although it's not always commonly done. And this one does have some treatments. One of the things you can do is called a medication called modafinil, which is a stimulant medication, helps you stay awake. And there's other choices as well. And I just kind of want to preface to say that, a lot of these things like the medications for the chronic insomnia or the medications for the narcolepsy, you need to have a diagnosis from a physician in order to get these medications. And, if you think you have these questions, you should ask, but don't necessarily think you have them just because you fall into some of these symptoms. You really need to work with a medical professional in order to make that diagnosis. But just for information's sake, I wanted to put this up here, just so you have a little bit more knowledge. Now, this is not really a sleep-related disorder, but it's actually something I find that's quite common, especially in older males, that is disruptive to sleep. And this is what's called BPH, or benign prostatic prostate hypertrophy, and I put a picture up here on the right side. This prostate is actually, let's see if I can I draw here? I can't draw. Well, the prostate's, it goes around the urethra, which is the tube that carries urine out through the penis. And in males, this gets larger as we age. And what happens is, you can see here, this is a normal prostate. Urine's able to pass through it, and you're able to go to the bathroom and fully empty your bladder. What happens with BPH is, as men get older, this prostate gets enlarged. And what this causes is, sometimes it gets so tight that men aren't able to fully empty their bladder, or it's very painful or difficult to empty their bladder, or what they find is they wake up multiple times during the night, because since the bladder is not fully emptying, they're peeing multiple times. So this is a common cause of nighttime awakenings. There are some treatments available. Medications like Flomax exist. So luckily, this is a pretty treatable condition. There's some surgical techniques as well. Typically, this affects males when they're starting in their 40s or 50s is when you start seeing this, and can get progressively worse as a man ages. So if you think that this is a problem for you, feel free to bring this up with your family doc. They might start a medication or refer you to a urologist, which is a person who specializes in the, urological conditions like BPH and other things like that. And it's something that, I think if you get this treated, that can be really beneficial for your sleep. All right, so that's kind of the end of my talk. I know I'm a little early. We had scheduled out an hour for this. So I'd like to leave any time if you guys have any questions. Feel free to type them in, or I don't know if you can unmute yourself and ask them. Thanks for joining. Appreciate your time.
Thank you so much. All right, good. And let's see, people tend to ask questions as we go. So I'm going to go ahead and ask a couple that I have here.
Sure.
So I just wanted to have a better understanding of why some people need more sleep than others, or it seems that way anyway. Where, I like 8 hours, some people like 6, and they seem to do fine. I mean, is that a real thing that some people need more than others?
There are some people that are what are called short sleepers. Kobe Bryant was someone that people think might have been a well-known celebrity who allegedly only ever got 4 hours of sleep in his life, and he operated at a very high level, right? So he was a NBA champion, 4 hours a night, every day of his life. He'd wake up and go to practice. So there are some people, and we call those short sleepers, but they seem to be pretty rare, maybe less than 1% of the population. There is some genetic influence. I don't know if anybody's ever taken 23andMe, but some of those 23andMe tests will tell you, you're more or less likely to, based on your genetic profile, to wake up at certain times or need a certain amount of sleep. So I think there is some truth to different people needing different amounts of sleep on a genetic basis. But I think one thing to keep in mind is that I talked about the tolerance as well. So some people, when they don't get enough sleep chronically, you do build a tolerance to it somewhat. But what you probably would find is a lot of those people could be operating more optimally at a higher level, maybe in their workplace or with their athletic stuff, if they did get more sleep. So, I think as a rule, I still say to most people, aim for, at least for adults, aim for 7 hours. 8 would probably be optimal. If you're getting less than 7, unless you're kind of one of those genetic humans, you're probably doing yourself a disservice. But it does vary a bit. And then also when you fall asleep changes too. Like we said, some people genetically, we call those delayed sleep syndrome patients. Sometimes they or night owls, commonly they're called, they might not fall asleep till 12. And that is a real thing. Or shift workers. If you work at night for a certain amount of time, sometimes you develop that tolerance, and then you just can't fall asleep earlier. Even after you stop working that shift, it can permanently disrupt your sleep, which is a real thing.
Wow. It's a scary thought.
Yeah.
The permanence, Wow. Yeah, I definitely have heard that some people have that genetic trait, and it's when people are that way, then they don't, even yawn. I mean, it's like they're not tired and they're getting 4 hours. And I'm very jealous of those people personally. So.
Yeah, it's not as common as you'd think, though. Probably most people that are getting that much sleep probably aren't getting enough. Like I said, it's probably somewhere on the order of like 1% or less that are those short sleepers.
Right.
We don't necessarily know why that's the case for some of those people, because sleep does seem to have such an important function in memory and performance and
for
health.
Sure. So we've got a couple of questions that came in. One person asked, what can you do to prevent your arm from falling asleep if you lay on your side?
All right. Yeah, you know what? That's actually one thing I didn't touch on here. There's really 3 different types of sleepers. There's back sleepers, side sleepers, and stomach sleepers. Right. Probably most people fall into back sleepers. I think stomach sleepers are the minority. Side sleepers fall somewhere in between. Probably most people that are having their arm fall asleep are side sleepers. So you could try adjusting your sleep position. You could try back sleeping, and that's one thing you could do. But besides that, it's really just positional. It's really the only thing you can do to influence that. There are some, I don't know how strong the evidence is, but there's some evidence that, stomach sleepers and side sleepers can have increased incidence of things like back pain as well. So I think maybe back sleeping is probably the preferred way if you had to ask someone, if you said what's the best way to sleep, but really you see all 3 types.
So are there special pillows for side sleepers? Have you seen that or?
Yeah, you can get special pillows. I don't know where exactly. You probably could just get them online at Amazon, but yeah, there are some different types of pillows and thickness of pillows, right? So if you're a back sleeper, your pillow is probably a little thinner. If you're a side sleeper, you'll need you can just imagine you'll probably need a thicker pillow because your shoulder is going to be keeping your head farther off the bed, where your back sleeper, you're more in contact with the bed. So yeah, there's some different thickness of pillows that you can look into. If you're a side sleeper, you might try a thicker pillow. If you're a stomach sleeper or a back sleeper, you're going to do a thinner pillow.
Very good. Very good. All right. So some more are coming in. Do you have any recommendations on the environmental factors of sleep, like keeping the bedroom dark, cold temps? We kind of went over sleep positions, but.
So environmental factors that affect your sleep. You can definitely, you want to try blackout curtains. So the darker the room, the better. That's really important. That's something that I think is kind of underrated. A lot of people live near streetlights. If you're in the city, like in an apartment or in a condo, and those streetlights coming off can keep you up as well. We talked about light being an influence on wakefulness. So blackout curtains are something you can get. I think you can get those at probably Home Depot or something like that. And I tell people to get that all the time. You'd be surprised how often that's the case. Sometimes people have really bright night lights in the hallway because they're scared of falling at night or something like that. And you can reposition those so they're not lighting up your room as much. Temperature wise, you do want to keep the room at a cooler temperature. So something like probably like 68 degrees or below. You don't want it to be too cold, but err more on the side of a cooler room rather than a warmer room for optimal sleep. And then, we talked about sleep positions already. Most people have one they favor, but I think if you had to pick one, if you can sleep more on your back, it's probably a little better for your posture and things like that.
Interesting.
And then I see another question here, talk a little bit about cognitive therapy for insomnia, meditation, be part of that. Yeah, so I think, meditation is a good relaxation technique. I don't know if that's strictly speaking the same type of cognitive behavioral therapy that would teach you. It's one technique and that's kind of like that Army 2-minute drill, where you do, you start, close your eyes, you set your phone, put your alarm, put it aside, get away from your bed. Sometimes I even tell people, put your phone on your dresser so you're not tempted to use it, or put it in the hallway charging. And you just close your eyes, try to just clear your mind of all the thoughts, that are going on, all the racing thoughts you might have, your anxiety about not being able to fall asleep. Just focus on your breathing, in and out breathing, and just kind of the rhythm of your breathing, and then just sort of relax your body. And that's one thing you can do. As far as the cognitive behavioral therapy, some of that is just for other things, it's defeating or disrupting negative thought processes. So if every time you go to bed, you just tell yourself, I can't sleep, I can't sleep, I can't sleep. That's an abnormal thought process, or a negative thought process that's going to be disruptive to your sleep. So that's one of the things they might talk about if you did cognitive behavioral therapy, is maybe when you go to bed, changing your attitude towards sleep and saying, I am going to sleep tonight, or these things aren't going to keep me up. And it's really just, it's almost when you're faced with adversity or negative thoughts, how do you deal with those in a positive manner? Usually, as far as cognitive, I wouldn't be someone that would actually do cognitive therapy. You would meet with a psychologist who's trained in it, or some social workers can do it as well. And usually that's usually through a referral from your primary care doctor. Although I guess if you knew someone, some of them are cash pay, or you can meet, maybe if you get if you have certain insurances, you don't necessarily have to have a referral, but a lot of times it's a referral to a psychologist or a social worker.
Very good. All right. Someone had a question about, I'm trying to go somewhat in order, but also about weighted blankets. Do they really help as they claim?
I haven't heard that, so I can't really speak to that.
Yeah.
As far as being helpful. Although I can imagine if they're too heavy, that might actually disrupt your sleep, because it can make you get too warm. But as far as the pressure of the blanket from the weight, I can't really speak to that. I'm not sure if that's
the only ones personally that I've heard is people who have especially kids with sensory issues. I've heard that's used with them, and so I don't know if that's a sleep issue as much as
and that is something that can be done with some kids that have things like autism spectrum disorders. I know that is a technique that's used by some therapists, but it's not something I know commonly used for sleep. It's not something I routinely recommend for sleep. I usually go for the temperature, the light of the room, when you're going to bed, avoiding screen time. Those things I think are low-hanging fruit. But maybe I'll look into it more on the blankets. I can't say beyond that.
Okay, that's fair. It's maybe it's not really a sleep issue with the blankets as well. Now, what about, are there any other common causes of sleep paralysis besides the side effect of narcolepsy?
Sometimes long naps can actually be a cause of sleep paralysis. So if you're taking long naps, or you're taking a lot of naps during the day, that can disrupt your ability to go into the REM sleep. So you'll wake up sometimes and have that sleep paralysis. So yeah, napping can be a common cause of sleep paralysis as well.
Interesting. Wow. How can someone stop severe calf cramps during the night?
So that was one of the things that I didn't quite make it into this lecture, but that might be something related to a condition we call restless leg syndrome. It might not be, but sometimes restless leg syndrome can manifest as a feeling that you have to shake your legs out like they're cramping, or maybe you have bugs crawling on them, or do you feel like pins and needle sensation, or maybe they're heavy and you feel like you just have to shake them, or you have to get up out of bed and walk. And that is a medical condition. If you find that's the case, you're always going to bed, your legs are getting heavy, you're having to shake them out, get up and walk. That's something you could try to talk with your doctor about. There are some medications that can be tried, and certain deficiencies and some things like magnesium can sometimes play a role in that. So if you're finding that's the case, it's just something worthwhile to bring up with your primary care, and there are some options and treatments available for that.
Very good. So someone asked, what are some steps you can take when first trying to improve your sleeping habits and moving your sleeping schedule to an earlier time?
Right. Yeah, this is something that comes up a lot. If you're finding that, you recognize maybe you're staying up too late, or your sleep habits aren't great, I think incremental changes are easier. If you should be going to bed if you know that you need to get, let's say, 7 hours of sleep, and you're going to bed at 1 o'clock and waking up at 6 every day, then you're only getting 5 hours of sleep. But it's going to be difficult for you to just change that overnight. So you can try moving your bedtime by half hour or an hour each day, if it's a really deeply ingrained habit, sort of like we talked about with the jet lag. So it takes about an hour per day to change your sleep and to kind of reprogram your circadian rhythm. And I did mention some people that, work night shifts or they're really shifted. Sometimes it can be a real issue and they have to use some medications because they really, if you've done it for years and years and years, sometimes it is hard to reprogram. But if you're going to try and do it on your own, I would say a good rule of thumb would be change your sleep by about an hour a night until you reach the optimal bedtime to get the correct amount of sleep. So like I said, if you're going to bed at 1, but you really should be going to bed more like 11 or 10, then changing your sleep by 1 hour or a half hour at a time would be a sustainable way to do that.
Oh, it seems doable too. So you just mentioned jet lag, so I'm going to go with that question next. Someone has international travel coming up. What can they do to help combat jet lag?
Yeah. It's difficult, right? So we'll use the California example because it's I think pretty common. 3-hour sleep difference. I guess if you're going to international, you might be going to Europe. That could be even an 8-hour sleep difference. Mm-hmm. It's pretty tough to do on a regular basis. You could try some medications on a short-term basis. So if you were to talk to your physician, they might give you something that can help you sleep on the plane. If you were going to try and do it on your own, like I said, using melatonin can be helpful. And also just understanding that it is going to take a little while for you to adjust your sleep. You might even have to do something like, if your sleep is off by so much, you might have to go to bed earlier in whatever country it is you're flying to. If you're 5 hours off, you might need to be going to bed at 7 or 8 p.m., initially, even though everyone else is still awake. That could be one thing that could happen. You can also use melatonin before you want to go to sleep. To help kind of induce sleep. That's another option as well. So with the California example, we fly back 3 hours. Our bedtime is normally 11. Now it's 8 o'clock California time.
Right.
We could basically try and adjust our sleep by 1 hour at a time. So we could try to go to bed at like 9 in California, and then 10, and then back to 11. So 1 hour at a time while we're going back. So the first night would be maybe 9 o'clock, then 10 o'clock, then 11 o'clock on the third day. So, but for short trips, there's not a lot you can do. So if you're a business person flying to Europe and you're only going for 3 or 4 days, part of the reality is you're just going to be tired. You can't really make that 7 or 8 hour switch in just a couple of days. It's not really possible. But you can try and stick to your natural sleep schedule as much as you can. So.
All right. So how about have you heard of paradoxical intentions for sleep? It's apparently a method in CBT.
I have not. You stumped me, Sarah. I have not heard of that. I'll have to ask you about it later. Any other questions?
I think that's it. I think we've got everybody covered here. So thank you guys, everybody, for all your questions and for joining us this evening. Great presentation, Dr. Woelke. This is wonderful.
Yeah.
And we're going to obviously have a recording of it, Joe, right?
Yep.
A week or so?
Should have a recording of this available on the library's YouTube page in about 1 week from tonight. So that will be next Tuesday, I believe, the 24th of November.
All right. Well, thanks for having me. And, I guess if you have any questions, I'm over at Rochester Ascension. You can always come find me there if you want to talk to somebody about sleep. But, and your primary care is always a great resource. I think people don't realize that it's part of our training. You don't necessarily have to see a sleep specialist to talk to someone who can help you with a lot of these relatively common issues.
Excellent. Thank you. And you can always email me. I'm on the website as well, and I'll send them to Dr. Woelke.
All right. Thanks for having me.
Take care.
Thanks for joining us, everyone. Good night.
Good night.